You're listening to the Public Health Entrepreneurs Podcast with your host, Dr. Charlotte Huntley. Welcome to Public Health Entrepreneurs, the podcast for visionary leaders who are ready to transform public health and healthcare through innovation. I'm your host, Dr. Charlotte Huntley, and as a public health entrepreneur with over 25 years of experience in healthcare and public health, I understand the unique challenges and opportunities that come with bridging multiple disciplines. If you are an interdisciplinary professional, in other words, a high-functioning leader with expertise across different fields, then you are in the right place. Today, I'm answering a question that I've received, and the question is, how do you explain what you do when it crosses multiple fields? I love this question. I get it from time to time, but it's very specific to those of us who are these interdisciplinary professionals. So we have multiple sets of expertise, different fields, degrees, industry experience, and so forth. And we are blending one or more together. And sometimes it's not as easy to answer that question. So I love receiving this, but it's something that there's no short, easy answer to it. So I'm going to talk you through it. So as my background is blended, as is the case with a lot of you, but I've worked as an epidemiologist. So I would say that is where I primarily will describe myself. But if I say epidemiologist in conversation, most people don't know what that means or what I do. And it's fair. It's not a common, like a police officer or a teacher or a nurse, something that people really understand immediately. It takes a minute. So I was in a phase where I just didn't want to try to explain it. And then imagine trying to explain as a public health professional, which is already broad and vague, and then trying to explain an epidemiologist. When I was in healthcare, it was difficult. I worked in the microbiology lab, but I could more easily explain that. I worked in the hospital lab and I identified infections and different wounds and would be able to let the doctors know what caused the infection to make sure they were prescribing the right antibiotics. That was a much easier one. It was easily understood. But this one is a little more complicated. And then when I moved into entrepreneurship and started my own business, that was really a really loud record scratch moment. And it was just really hard. So a lot of times I avoided trying to explain it. Back when I started podcasting, back in 2017, I would spend a great amount of time explaining what a podcast was. So nowadays, you don't have to worry. Most people have a podcast or know someone who has a podcast. It's very common. But back then, it wasn't. And I would have to spend a lot of time explaining what a podcast was or directing people to platforms to find it and to how to access it. There was a lot that went into it. So part of me just didn't want to even try to explain it all. It was just too complicated. But when you're in business, you need to be able to explain what you do because a large part of our network is really rooting for us. They care about us. They like us. They want to see us succeed. So if they understand what we do, then they can help bring ideal clients our way and make recommendations. If they don't understand, it's a tremendous lost opportunity for new business for us. So we need to find ways to communicate and answer the question of how do you explain what you do when it combines multiple fields? The short answer is we just have to keep trying until we get it. And there's no getting it right. You'll have probably a few iterations of it that will run through your mind or have in sort of your briefcase, so to speak. So depending on the situation and the circumstances, you're kind of ready with a couple iterations of what to say or how to introduce yourself in what you do. So having blundered through all of that, I'm going to share with you an example. This is something that I just recently did, and I'm going to encourage you to even scope out my LinkedIn profile and see for yourself. I'm going to explain to you a little bit of the strategy behind it. So right now, I have multiple things going on, but we are super hyper-focused in my consulting business on attracting new clients. We need to bring on a new client relatively quickly. So we're really focused on how do we attract our new client? And we're going through all of the strategies that I teach you on this podcast. So we're working through leveraging the people that I know, the relationship marketing, and we're optimizing LinkedIn. So I've updated my profile. It's important that people understand that I support entrepreneurs and the type of entrepreneurs like through this podcast, but my consulting business is the larger business and the more primary business. And that is where we are focusing our efforts and attentions to looking for consulting clients. So the right type of client. And the problem that we're solving is creating these community assessments. So one of the things that I've learned over the years is that, especially thinking about multiple disciplines, in different industries, a community assessment has a different name and the same sort of meaning and underlying principle, but it's referred to with different jargon. So you know how we can be siloed in our own industry? Well, across multiple industries, we have a different name for the same thing, essentially. So on LinkedIn, I decided to create a really robust post that explains these community assessments and what they mean in about 4 or 5 different industry type or siloed jargons that represent my background and my expertise. So I created that post. I shared that post, and then I featured that post on my profile so that when people, as I'm engaging with people and they stumble on my profile, it's featured on my profile. So it's one of the first things that would likely capture their attention. So let me give you an example. When we talk about community health assessments, I started my post with community health assessments have an identity crisis. And then I go on to say, same purpose, different names. Here's a guide to the terminology. And then there's about 5 examples I gave where they're called something different in different industries. And I sum it all up with a common thread and how we help address these challenges and how we can help support your organization potentially with these assessments. Okay. And a strong call to action to connect with me. And that was the post. So that same concept, and please do go to my LinkedIn profile and poke around and check that out and you'll see what I mean. But back to how do you explain what you do? So if you're trying to explain what you do, remember we are problem solvers. So find a way that you can explain what you do, the problem you solve, and who you serve, and make it in as plain of language as you can, because you therefore don't want to have any assumptions that the person that you're speaking to or being introduced to understand your industry. They may or may not, but you avoid that awkwardness and you make it very relatable so everyone can understand what you do. And then they can go back and tell other people. And also it introduces the conversation so that it's not overwhelming. People get it. They can understand. And there should be some exchange back and forth. So your first response is not some 4 paragraphs of the different types of things you do and what it means in every other way. But maybe you can come up with, like I did with that example of community assessments and what it's called in different industries and how they use it. Maybe you can think of what you do and what that might mean to some of the different people across the different industries that you represent. So if what you do is referred to in healthcare one way, but public health a different way, have an answer or response that bridges both. If you are in, let's say, pharmacy or especially pharmacy, some of the terms and phrases that you may refer to or things that you talk about in your own industry is much more complex to someone who is not in your industry. So having some of those examples kind of on the ready, you don't have to spit them all out at one time, but you need to be able to have some of those ready to explain to people what you do. So everyone, they don't necessarily need a big, deep rundown. They want to understand the gist of it. So I'll give you, using myself as an example, sometimes in the most simple terms, I'll just explain that I bridge my healthcare and public health background in a way that allows me to serve nonprofit organizations and help them to communicate their health information in plain language. Sometimes I don't use the word data. I rarely use the word epidemiology up front. Sometimes I'll explain that I follow trends and patterns of disease among groups of people to help understand what the causes are and work toward prevention. which is essentially explaining public health without using public health, because some people still don't even know what that means when you say it. And I know this is resonating with a lot of you. So instead of running away, because it is a bit of a challenge to figure this out, you might start by typing out a few things that you want to say, but I encourage you to practice saying those things out loud, because sometimes what you type up and then what rolls out of your mouth are not exactly the same, or it doesn't quite flow as the way you think it would flow. And then test it out in conversation to make sure that people are understanding and it makes sense to them. And you can test it out with a few close friends. So if you've been like me at the beginning where you just kind of didn't try to explain it to people, and then all of a sudden you decide, okay, I need to do that. You don't have to explain your first rollout to everybody. Pick a few people and have a conversation. Explain what you do and see if it makes sense to them. That's your best way to validate that and continue on from there. Because one of the best things, if you've heard me say multiple times, is when people really understand what you do and can go out and talk about that and bring you the right type of clients. That's a wonderful situation to be in. And whenever you are around friends, family members, colleagues who do not understand your ideal client types or really do not understand what you do, don't be frustrated. I mean, it's easy to get frustrated, but it's an opportunity for you to clarify that. It's in your best interest to clarify that. I was in a situation like that recently with a mastermind group that I'm in. And these are some really powerful, wonderful leaders. They really like me. And some of them I've known for a few years and some I've only known for a few months. But I realized that when it was time for like recommendations or referrals, I needed to get a little more granular with each person in a slightly different way. And you'll know when you start talking to someone and you've explained a little bit and the conversation's flowing, you'll understand, all of a sudden get it, because then instantly they can think of 3 or 4 people to introduce you to or recommend for you or refer you to. And that's the sweet spot. That's what you're looking for. That moment when the other person, it clicks for them and then they instantly know who to bring your way. So for example, if I'm talking about large nonprofit organizations that are health focused to someone who may know some other executive directors or nonprofit leaders, well, they're going to be thinking about large nonprofits. And I say large nonprofits specifically because those are the types of organizations I like to work with. They usually have the largest amount of the problems that we solve. So anyway, when you practice doing this and finding a way to blend your expertise together and communicate that, what you do, the problem you solve for your organization, and you've got to practice it, and you'll have a few different iterations, but that is going to be worth your investment in time and energy to do so. It's not the easiest way. The easiest way to just ignore it and not really come up with something to say if you feel like it's just too complicated, or to just, roll your eyes and get frustrated when people don't get you. I mean, we could do that. And sometimes we just let it go that way. But I encourage you for me, I had to gamify it a little bit. And I just encourage you to do that. So how you explain what you do when it blends multiple fields is a creative exercise for you. There's no one size fits all answer, but in simplest terms, just remember, I guess, a couple of key takeaways. You don't have to put everything into that, explanation or introduction. They don't have to know everything all up front. You don't have to blend all of your expertise together. You need to more than likely think of what aligns the best to help that in terms of your background and interdisciplinary expertise and your business, like the problem that you're solving, and serve up the best combination there in your introduction. And that will serve you well. That gets the conversation going. And then as you get to know whomever you're speaking with and communicating and networking with, then other things can come up as well. But you don't have to put everything all in one. And you may have more than one iteration that you kind of carry with you, maybe a couple of examples of how you could lead with that introduction, depending on the setting and who you're speaking with. For example, if you're for myself, if I'm at a public health conference, all the people there, the majority of people are public health professionals or students, then I lead often with epidemiology because they understand I don't have to explain it. That's a very rare and unique situation. Any other setting, I don't automatically lead with that because it doesn't set up the conversation to be off to a very good start from the beginning, but I let it emerge. So I've tested it out in so many settings, in so many situations, and you have to just keep doing that to become comfortable with it. And then you're going to be surprised at the random opportunities that cross your path and you're able to capitalize on because you've practiced this and you've become really good at it. So I'll share one funny story and then we'll wrap up. We were on vacation. My husband and I, we were at a resort that is like a mountain resort. We absolutely love it. And there was a conference happening in the resort hotel, and it was a group from the Rotary. Now, I didn't know anything about Rotary. I still know like a teeny tiny, very little bit. I don't think it measures about Rotary, but I was curious because there was a guy walking around. He was like an attention seeker. He had this like belt on. It looks like the kind that wrestlers wear or boxers wear when they win. And he had it just like hanging over his shoulder, and he was walking through. And my husband and I were just kind of giggling because like, what is he doing? I'm going to ask him. So I don't know. He kind of dared me. One thing led to another. So we crossed paths with this guy, and I just finally went up to him and I asked like, what is that? What is that belt? What is that all about? And he began to tell me how, that the Rotary Club was having their convention, and he created this belt to share or to give to people who were winning awards or whatever, to kind of show that they were superheroes, or to give them a positive accolades, like you are a superhero, you're doing great work, positive attention. I was like, oh, this is great. I said, okay, well, what is the Rotary Club anyway? So he began to explain it to me, and he talked about how they are I was intrigued, the work that they do in the community to help address disease, to address issues that relate to health. And they're very actively involved in the community. So my eyes perked up, and he said, well, what do you do? And then I explained to him, I said, well, actually, I'm a public health doctor. I'm an epidemiologist by trade, but I work to serve populations by helping them to understand health information and make informed decisions that help to improve health. So I work with large nonprofit organizations that are serving communities to help address some of these challenges. And then they got really excited. So all of a sudden, it went from this funny kind of conversation about, me wanting to know what this belt was, to them, and it was three guys. When I stopped, there was the three people in a group, my husband and myself, these three Rotary leaders. So I happened to be chatting with like the president of the region, and I didn't have business cards. I was on vacation at a resort, but they were very intrigued, and they like, we should have a conversation. We should keep in touch. And I was like, we absolutely should keep in touch. This is great. So they had a notebook, and on the notebook, I wrote down my information, and he followed up with me. They didn't have a card to share with me. I didn't have anything to write down. It was just really kind of a messy situation. But because I had gotten into the habit that I've just described to you, even in the most relaxed, casual, non-business situation, I was ready to explain what I do to a group of people. And I was quickly able to assess, based on what they were saying to me, I could give them a version of what I do that I knew they would get right away based on what they were describing. And that led to, right now we're having conversations about potential partnership and how I might be able to serve them because they're in my region. So you just absolutely never know where the opportunities are, number one. But I say all that to say years of just practicing, and sometimes it lands well and sometimes it's a complete flop. Okay. So it's not like you just suddenly arrive, but because I do try to explain and blend, kind of bridge my expertise together. I didn't tell them everything. We didn't go into, a deep dive. It was enough to make them really interested in wanting to meet with me. He's already looped another person in, and we're planning for a meeting. So I guess I'll have to let you know how that all works out. But hopefully you're taking away from this that it's not about something perfectly laid out, but it's something that we have to keep working on and doing. But the rewards and the payoff are amazing and tremendous. So it's definitely worthwhile. And just remember, like I always say on these episodes, as interdisciplinary professionals, we see things that other people don't. We have a very unique lens and perspective that's high value. So never, ever forget that. If you are looking for any type of guidance on this journey, I encourage you to reach out to me. I am able to work with people one-on-one. Right now, that is probably the largest request that we receive, and it has a lot to do with the nature of times that we're in right now. Some people really want my undivided attention on their specific business and challenges and issues. So I have been creating more space for that type of work. And if that's something that you're looking forward to or looking toward having support with, then please reach out to me. I'd love to discuss with you what that might look like and what those possibilities are. you can reach out through publichealthentrepreneurs.com. That's our website, and the links are also in the description for this episode. Just go to the Contact Us page and send a request. Share some information and details about your background, your challenge, your business, and let me know that you heard this episode and, that you'd like to talk about working one-on-one, and we'll follow up with you and make that happen. All right, everyone. Until next time, have a fantastic rest of your day. Thank you for listening. Visit publichealthentrepreneurs.com to learn more.